My name is Linstad. I am a department manager for one of the 4 departments at NST. And the department is called Department of Prevention and Self-Management. Yeah, I think so. NST, the last 10 years we've been participating in more and more EU projects, and it's really beneficial for the activities we do here. But of course it's beneficial for Europe as well. So we've got lots of European friends and partners, and we're developing more and more activities with them, and we share knowledge and we learn from each other, and we see how their competence is complementary to the competence which we have. I think that if you're asking me about how we would see healthcare services delivered across borders, I think that some of it might happen, but I think that most of it, the large activities, the large meetings between healthcare and patient actually happens in the GP's office, and that's really local. But of course, the activities you're doing there and the way you communicate with your patients by using ICT could be something which you've developed through the cooperation in Europe, because you learn from each other and you see how the Danes are doing things, how the Scotland is doing things, and you can sort of adjust it to your local arena. And we've actually done something similar to this. 2 or 3 years ago we started a project with NHS Scotland, and we showed them how we did teledialysis here not in Europe but in Norway. And there were a lot of dialysis nurses coming over here, and they saw the service, and then they took it back to Scotland. And I know that now that NHS Scotland they've developed it and they've implemented a service which is similar, but of course you also always have to adjust it to the context, the local context. In March we're starting a large European project called the Mastermind. It will focus on CCBT, cognitive therapy, net-based cognitive therapy. And I was in a meeting with the consortium, and then I saw that people from Netherlands, they have lots of knowledge in this, and they have done lots of research showing the results and so on. So we're going to integrate it and put it into practice. We're not going to do a lot of research because we know already that it has effects. So we'll be doing that with Denmark, Scotland, Finland, and some other from the southern part of Norway, no, some southern part of Europe as well. So in that project we've learned, and we're learning from each other, and we're trying to implement that kind of service on a larger scale.